Hi, welcome to our video. This here is Billy. He has ADHD, which is also known as Attention Deficit Hyperactivity Disorder. Billy and I hope that you'll be able to answer a couple questions after watching this video. The first question we'd like you to answer is, what is ADHD exactly? The next is, how do we identify students who might have ADHD? And lastly, what are the psychological and behavioral characteristics of a student with ADHD? So let's move on to our first question. What is ADHD exactly? The DSM-5, which is also known as the Diagnostic and Statistical Manual of Mental Disorders, lists attention deficit hyperactivity disorder with two subtypes. The first is inattention, and the second is hyperactivity and impulsivity. People can exhibit characteristics of one or the other, or even both. Some people believe that all children with ADHD exhibit hyperactivity. By a show of hands, how many of you think that this is a true statement? Hopefully, none of you raised your hand. Students with ADHD can be solely inattentive as well, or maybe a little bit of both. Another important factor in understanding ADHD is that boys tend to be more prevalent than girls. This estimated gender difference can be seen in a 3-to-1 ratio. Let's move on to our next question. How do we identify students who possibly have ADHD? Since teachers and professionals have had difficulty identifying students with ADHD in the past, authorities agree that the following four components should be considered when assessing whether a student has ADHD. These are a medical examination, a clinical interview, teacher-parent rating scales, and behavioral observations. Let's take a look at our first one. Why do we need to have a medical examination when determining whether a student has ADHD or not? This is an important step because we want to be able to rule out any other medical conditions with similar signs, such as brain tumors, thyroid problems, or seizure disorders. These and many other disorders can have the same implications as ADHD. Our next tool in determining whether a student has ADHD or not is a clinical interview. This allows professionals to have some insight into the child's characteristic as well as their family dynamics. These and other factors can have an effect on how a child acts in school. Our third component is teacher-parent scales. Professionals hope to bring some quantification to the process and therefore have teachers and parents fill out scales. These ratings are based on how often an individual does not pay attention in class, gets distracted, fidgets, and so on. Our last tool in identification is observations. We want to be able to use behavioral observations by clinicians, teachers, and parents. So let's move on to our third question. What are some of the psychological and behavioral characteristics of individuals with ADHD? Many students exhibit some of the following characteristics we're going to discuss. The first characteristic we're going to discuss is problems with behavioral inhibition. Behavioral inhibition allows people to delay response, interrupt an ongoing response, and protect responses from distracting stimuli. Students who have issues with this have difficulties staying on task. Next, we want to discuss our executive functions. The following executive functions can pose problems with individuals who have ADHD. These are working memory, inner speech, emotions, and analyzing problems. Our first executive function is working memory. Deficiencies in working memory can lead to forgetfulness, a lack of hindsight, and issues with time management. Our next executive function that can have an effect on students with ADHD is inner speech. Inner speech is the inner voice that allows people to talk to themselves. People with ADHD can have a deficiency in inner speech, giving them problems with guiding their behaviors. Our third executive function is emotions. Individuals with ADHD also have problems controlling their emotions. And our last executive function is analyzing problems. Children with ADHD can have difficulty analyzing problems. This lack of flexibility means that they tend to have difficulties communicating their solutions to their peers. All of these characteristics can be seen in an individual with ADHD. So that's it. Billy and I hope you have a better understanding of what ADHD is, how to identify it, and what characteristics are common with the disorder. Bye-bye!